In this lesson, I will better explain the risk factors that could put a patient at a greater risk for comorbidities or her baby at risk during the pregnancy. Promoting preconception health can potentially improve a woman's health and pregnancy outcomes. So let's look at different maternal risk factors and the specifics behind them. So genetics is going to be a big risk factor for women. So we have a risk of heredity if they're going to pass it on, or if it'll put them more at risk for whatever genetic disorder that they have. Then the next one is abuse and violence. So this is going to be obviously risk to the unborn child if the mom's being abused while she's pregnant, and stress to the mom, adding more concerns. Nicotine and substance abuse. So another huge one. So drugs cross the placenta. So we worry about this hurting the growth of the baby, and we always worry about the baby being addicted. The babies can be born addicted to nicotine. And then of course, any opioids or drugs that are used. And then the other little point that I want to make sure you understand is alcohol. So there's really no safe amount of alcohol, and it does get across the placenta, and it can cause some defects for the baby. So if you refer to your lesson on fetal alcohol syndrome to better understand that, but we do worry about alcohol with fetal alcohol syndrome. Then our sexually transmitted infections, our STIs, so they can pass to the infant, things like HIV, herpes, what else? So many more. Syphilis, our chlamydia, gonorrhea. The babies are given medication at birth for that, but still can cause some problems and can pass to the infant. Some of these even can cause death to the infant. So mental illness, another one. This is risk to mom and the child. I'm specifically speaking of postpartum depression, because those hormones just get crazy when they're pregnant, and then they crash when they're not pregnant. And so they can just be more at risk for postpartum depression. The reason why the child is at risk is because sometimes we worry that the postpartum depression, if left untreated, can go to psychosis, which is when they start to hear voices and things about harming their child. So some other risk factors are going to be cardiac. So if you think about it, the heart has to work harder when you're pregnant, okay? There's more weight during pregnancy, but also there's more blood volume. Blood volume increases for a patient that's pregnant. So if they already have cardiac problems, that pump doesn't work effectively, and now they have to pump more blood volume, it's going to be harder and put the mom more at risk. Diabetes, it's harder to maintain in pregnancy, and that's because of hormones. The hormones are all high, and that's going to make the blood sugar high. So the blood sugar goes up because of those hormones, and that's going to be a risk factor for the mom, and then of course to the baby because the effects of that. Then we worry if they're too underweight or if they're obese, they just don't have as good of nutrition. We want to make sure that they're eating healthy and are already healthy in preconception. Thyroid disorders. So with thyroid disorders, we worry a lot about frequent miscarriages and stillbirths. If it's not in control, it puts them more at risk. Then our younger, so really specifically under 20 years of age, we worry about they're more at risk for preeclampsia, which is a horrible blood pressure condition that can happen during pregnancy. So they're more at risk for that. And then our advanced maternal age. So that is our 35 plus women that are 35 years of age and older. Just their overall health might not be as well. So we worry about them in those different scenarios, putting them more at risk. They also have a greater risk of having genetic concerns with their infant because of them having older eggs. So this is going to put them at risk also for that. Poverty. So poverty is huge. These patients have a lack of resources. They have maybe no transportation. So there's a problem because they can't get to their prenatal appointments. But then not just that, but healthy food costs more. So they're not going to be eating as healthy if it costs more and they don't have money for good, healthy food. We also worry that they're not getting their prenatal vitamins as they should because, again, another cost for them. So we need to always make sure that these patients are well taken care of. We just don't have good resources. So the assessment pieces now that we need to gather are going to be the patient's history. We need to know if she has a history of any genetic problems. Does she have a cardiac history, diabetes, genetic concerns? We need to know this so that we can take care of it. Weight, we need to know their starting weight because we need to know and be able to help them understand how much weight they should really gain during the pregnancy. So their weight. Then we need to know blood pressure. So what is their blood pressure? We need to make sure they're in a good range. Do they have a good current blood pressure that we don't have to worry about? Or is their blood pressure already high? And this will be monitored the whole pregnancy. We also need to assess their level of knowledge. So does she realize the importance of prenatal appointments and getting to them? Our prenatal appointments. And does she know that she needs to take prenatal vitamins, or has she already started? So we need to make sure she's doing that. And then does she know how often she should be planning to go to the appointment? So just talking to them about when the appointments are going to be occurring to make sure that she's going to be present for them. All right, our therapeutic management. So our management for this patient is going to be, number one, we have to manage the problem. So treat whatever the risk factor is. Whatever it is, we have to treat it. Patients that are diabetic or become diabetic are going to be or could be instructed by the physician for other reasons, but we might need to be monitoring blood sugar. So specifically our diabetics, and then just obviously if they're given MD orders, so doctor orders for whatever other reason it may be. So they need to be checking their blood sugars frequently or whatever is ordered for them. We also might need to make sure the patient has referrals. So do they need to see a specialist? So do they need to see maybe a genetic counselor? Maybe they've already had risks with, abuse and violence, and we need to get them some information on help if they need it. They might need to see a dietitian to help with diet if they're diabetic or if they are severely underweight or overweight. Endocrinologist for our diabetics. So just many specialists to see, maybe a high-risk OB too. So those doctors will do more frequent checks on the baby, more detailed checks. Then our prenatal vitamins as part of our therapeutic management. We want to make sure they have healthy nutrition and they're getting their prenatal vitamins and understand the importance as to why, which if you remember, the big reason is going to be our folic acid. We want to make sure they're getting plenty of folic acid. And then follow-up appointments and when to continue prenatal care. So we need just to discuss this with them when to come back for appointments. Our maternal risk factors are going to be, or education for maternal risk factors, is going to be how to manage the problems. We want to give them information on that, give education on the prenatal vitamins, our follow-up appointments. We want to make sure they're avoiding substances and alcohol and get them help if they need to have help stopping this. And then smoking cessation, talk to them about that. So reproduction, human development, and health promotion are going to be our nursing concepts. Obviously, reproduction and human development, we've reproduced and we're developing a human. And then health promotion is important because we have the risk factors and we're trying to promote good health during the pregnancy. So good health, our key points here, is going to be essential during pregnancy. The patient has to be healthy to have a healthy pregnancy. It's just the best way to do it. So be healthy prior to pregnancy, you'll have a healthy pregnancy. And then make sure we're getting prenatal care because it's going to be essential for that patient that does have risk factors. We could have a baby that's too small or too large because of these risk factors. So the prenatal care is going to help be imperative to the patient to manage her factors and ensure that the baby is growing adequately. Make sure you check out the resources attached to this lesson and review all the different maternal risk factors and what they can do for the patient if they have them. Now go out and be your best selves today, and as always, happy nursing.